The emergency department, how it works, and what to expect. Hello, and welcome to the emergency department. You'll be asked some simple questions as you register. Please let us know if you've had any transmissible diseases or illnesses recently that could be easily passed on to others, such as COVID-19. You may also be asked about any vaccinations you've had for protection against illnesses, such as COVID-19 or flu. You should also tell us if you have recently received any treatment in a hospital or healthcare setting outside of Ireland. To protect our patients and staff, some of our staff will be wearing face masks and protective clothing. You are welcome to wear a face mask if you wish. On occasion, you may be asked to wear a mask by a member of staff. This is to protect yourself and others. Please wear a mask if you have been asked to and follow the advice of our staff. If you have a cough, cold, or COVID-19 symptoms, please wear a mask if you are able to. Remember to cover your mouth and nose when coughing or sneezing. Dispose of used tissues in a bin and wash and sanitize your hands regularly. When will I be seen? This depends on two things: how busy we are today and the severity of your injury or illness. The emergency department is not run on a first-come, first-served basis. Our staff always see the sickest people first. We use something called triage to determine who needs to be seen most urgently. Please follow advice given by staff. They are there to help you and other patients who need to be in the emergency department. How does triage work? After you arrive and are registered, you will be seen by a triage nurse. The triage nurse will take your blood pressure, temperature, and determine how urgently you need to be seen by the rest of our team. They pick up on signs and symptoms that might make your case more or less urgent than other people waiting. The triage nurse will prioritize you based on your condition. But if anything changes or you begin to feel worse while you're here, please let us know right away. Following triage, some patients may need to be isolated because of their condition and to protect them and others. Why am I waiting? Our emergency department is connected to a much larger network of people and services right around the hospital and beyond. All of these moving parts work to look after you, especially if your problem is complicated or urgent. There are lots of cases where care, tests, and results may take time, and this can lead to waiting. Emergency departments are carefully staffed, with more doctors and nurses when we know there will be more patients. But even so, if we have a lot of people needing care, we may need to ask people to be patient and to wait. Important information. Unless you need assistance, your family member or friend will be asked to stay in the waiting room. Why is this? Well, along with the concerns about space and privacy, we also need to protect each other and ensure risk of transmissible diseases is kept to a minimum. Exceptions may be made on compassionate grounds and for parents with children. Our patients' privacy is important. Please keep your mobile phone or camera in your pocket or bag when not in use. And remember, keep the volume down or use headphones. You are not allowed to take photos or videos in healthcare settings. Clean hands save lives. By keeping your hands clean when you come in and while you're here, you can help protect us all from infection, including our most vulnerable patients. It's important that the emergency department is a safe place for all patients and healthcare staff. If you are aware of any loud or unwelcome behaviour, please let a member of staff know. The majority of people attending the emergency department can go home after having tests or treatment. However, about a quarter need further tests or specialist care as an inpatient and will be admitted to stay. Sometimes when a patient needs to be admitted to the hospital for specialist care, there is no bed available on a hospital ward at that time. When this happens, the patient will wait here until a bed becomes available here or at another hospital. If this happens, our team will continue to care for you here in the emergency department until we can safely hand you over to the ward or transport staff. We are sorry for any delays that might arise, and if you have any questions or need anything, please ask one of our team. Part of our job is to make sure we answer your questions and give you clear information while you're here. So before you go home, please take a moment to ask yourself, do I understand my condition and the treatment I've been given? Do I know my next steps or what to look out for? If I have a follow-up appointment, do I know the details? Do I know what medicines have been prescribed and how to take them? Written instructions are easier to remember, so we suggest you take notes and ask for any contact names or details you may need. Our staff are working hard to provide you with the best care and support they can. Please treat staff and people around you with dignity and respect. Thank you. We hope this has helped to explain how the emergency department works. Please talk to any member of our team if you have any questions. Or for more information, visit www.hsc.ie.